highest rates of maternal morbidity and mortality. Millions of women live undernourished lives, die in childbirth, or give birth to children who are severely malnourished. The core reason for this is the absence of safety net for women. For instance, the abysmal access to maternal entitlements, which could keep women and children both nutritionally and physically secure. Tonight, we uncover how more than 90% of these women fall outside of any entitlements, have access to little or no benefits. Walk into the gynecological and obstetric ward of any district or rural hospital, or for that matter, any government hospital in any city. This is what you will find, especially among women from poorer backgrounds. Pregnant women with hemoglobins as low as 4, mostly underweight.
She is with 4 grams hemoglobin only. We require to have 14. Look at her face, puffy, hands swollen, all. She is very pale. She is a patient and has been admitted with breathlessness, swelling all over the body. Her hemoglobin is 2 grams only.
This is what we shot more than 10 years ago at the Zanana Hospital in Jaipur. A decade later, despite the hype over new schemes and government interventions, there has been little change in the statistics for anemia in pregnant women. According to NFHS data, the percentage of anemic women of childbearing age has only shown a very marginal decline from 55 to 53%. India continues to have among the highest maternal mortality rates. India also reports the highest numbers of deaths of newborns in the world. 700,000 newborns die each year. The struggle against malnutrition continues to be a tough one. 48.2 million children in India are stunted due to malnutrition, again the highest numbers anywhere in the world. For the past 20 years, we have repeatedly brought you reports that highlight these conditions that leave women and children desperately vulnerable in this country. The argument that India needs holistic maternity entitlements is not just obvious, it's a need that is urgent and critical. And in any civilized country, it is also a labour right, a right that every working woman should have, argues Dr. Vandana Prasad, a public health professional known for her work on malnutrition and child rights.
Maternity entitlements can be looked at from a variety of perspectives. So it can be understood, for instance, as a labour right of women who are working, but also who also perform the societal function of reproduction, childbearing and child caring. So that is understood as a wage compensation for children, for women who work to fall pregnant and to deliver children and then to participate in the care of their children. And in fact, paternity leave is also granted. So from that point of view, it's a wage compensation. Then it can also be thought of in terms of support to a woman's health in a particularly vulnerable period of her life where she is pregnant and delivering, and where the chances of both mortality and morbidity are much higher than otherwise, and which in countries like ours are particular areas of vulnerability.
What is urgent, obvious and critical, though, is sadly not what's often acted upon, not what's given a priority. India has an act and several schemes that promise maternity benefits, but most of the working women in India, those who work in the informal sector or even those who work in the informal part of the organized sector, are completely left out. And frankly, we don't even know who gets these maternal benefits. We simply don't have enough data. First, let's look at what we do know, some of the acts and schemes that exist on paper. The Maternity Benefits Act of 1961 gave women 12 weeks of paid maternal leave, later amended to 26 weeks, the cost of which would be borne by the employer in establishments with more than 10 workers. The fundamental flaw in this act was it assumed that women worked in formal establishments with clearly defined employers. That's simply not the case for more than 95% of women in this country. In 2013, the hope of maternity entitlements shifted to the National Food Security Act. under which working women not covered by the formal sector have to be given a minimum of 6,000 rupees. But this has subsequently been undermined.
In 2013, the government passed a National Food Security Act, which we call NFSA 2013. And within the Food Security Act, recognizing that, women need support in order to be able to take off from work and to take rest and then to breastfeed the baby after the childbirth. So it was mentioned that schemes must be formulated by the government, and based on those schemes, a maternity entitlement should be given to all women in the country, barring those who are already covered in the formal sector. Leaving those aside, all women should get money according to the schemes, but not less than rupees 6,000. The government of India, since passing the National Food Security Act, has not actually implemented this component of the law, and in a completely illegal manner has neglected it until early last year, when just on New Year's Eve, on 31st of December 2016, the Prime Minister announced that there would now be a maternity benefit scheme for all women. But what it actually came out with is a travesty of the law, and that is something called the Prime Minister's Matri Vandana Yojana, PMMVY. And this Yojana, in a very strange move, restricts the benefit to the first living child of the woman. So it's only the first pregnancy that is covered, and it only provides 5,000 rupees. So now we have actually a illegal scheme in place, because the law already stipulated that it should be a minimum of 6,000 rupees, and the scheme is actually promising 5,000 rupees. So this is where we are in terms of the informal sector from the Food Security Act.
There are several other sector-based schemes that seek to give maternity benefits to labourers working in those areas. For instance, the Mines and Plantation Act or the Builders and Construction Workers Act. But these are poorly implemented. A majority of the labourers in these sectors are not even aware of their entitlements, like these construction workers, for instance. बच्चा पैदा करने के 6,000 मिले?
नहीं मिले, वो नहीं मिले।
5,000 मिले?
नहीं मिले।
प्रधानमंत्री योजना या ऐसा कुछ किसी के बारे में सुना आपने?
नहीं सुना।
Quite alarmingly, even the Labour Ministry and Labour Welfare Boards seem to be unaware of who receive maternity benefits. In September 2016, Dr. Vandana Prasad filed an RTI to the Labour Ministry asking 10 questions. Here are some of the questions asked. How many construction workers in the country have received maternity benefits in the last 5 years? How many domestic workers in the country have received maternity benefits in the last 5 years?
The intention to specifically speak of these two categories was that behind the construction workers there is an act, and there is a cess that's collected, there is a fund of money, and there should have been a mechanism so many decades after this act was passed for this to come into play. Behind the domestic workers, who are recognized as a category of women workers quite well now, and nobody could deny the fact that they are indeed women workers, we do not have a legislation currently in place, and a National Maternity Benefit Act should really have taken care of these various categories.
Here are some of the other questions that were asked. How are the proposed amendments of the Maternity Benefits Act likely to cover women working in the unorganized sector? How many women workers in the country who work in the unorganized sector have got maternity benefits in the last 5 years? Of the entire female workforce, what percentage, according to the ministry, is engaged in the unorganized sector?
The other questions that were posed were around how the proposed amendments would take care of women workers in the informal sector. Unfortunately, there was a complete blank in terms of response from the Labour Ministry, who maintained that they keep no central records of any of these issues whatsoever. We had asked, for figures relating to the last 5 years, not forever and ever, but there is no data.
There is no data even for sectors where there is an existing budget for welfare schemes, like the Builders and Other Construction Workers Act, by which a cess is collected by construction welfare boards.
By 2012, all the 36 boards were constituted in the country, By now, lot of money, over 40,000 crore rupees as cess, perhaps another 60,000 crore rupees as interest, because it is more than 12 years, have been collected, but it was not being properly utilized.
Subhash Bhatnagar and his organization, known for their work with construction workers, are now fighting a legal battle to ensure that laborers get their due, especially women workers entitled to their maternity benefits. Ironically, while securing a monthly 6,000 rupees for 6 months for the poorest women is a struggle, a government employee of every category gets not just fully paid maternity leave for 6 months, but can also take up to 2 years of fully paid childcare leave.
We've been very struck by that, and we've also been struggling to explain it to the people who are in the Ministry of Labour, because we felt that women who are, in that ministry itself, women who are earning perhaps a package of 2 lakhs would still, on the taxpayers' money, be entitled to a whole 2 years, which is 24 months of full wage compensation in order to provide child care. And whereas if you're looking at women who are daily wage workers, who barely earn 150 rupees a day, and that too not all days of the year, for those women we are unable to provide these kind of entitlements, and they need it the most because they are so economically vulnerable. Every episode of maternity actually is a financially catastrophic expenditure because they can't handle these, hospital care and the travel and all the other things involved. And for them who are the most vulnerable, who really need it the most, we are not able to even put out an allocation that gets them 6,000 rupees for one pregnancy and childbirth.